Production and distribution of City Club forums on IdeaStream are made possible by the generous support of PNC, the Chautauqua Institution, the Cleveland Clinic, and the United Black Fund of Greater Cleveland, Incorporated.
Hello and welcome to the City Club of Cleveland. I'm Dan Moulthrop, Chief Executive here and a proud member. And in the midst of this continued stay-at-home order, we are broadcasting and presenting our virtual forum from the studios of IdeaStream, our public media partner. In the last 2 weeks, we've conducted a few forums on the impact of the pandemic, how it's the impact it's having on public health, state policy, federal policy, and the economy. And today we're visiting with the Honorable Frank G. Jackson, Mayor of Cleveland, to discuss how the city is responding to the coronavirus crisis. As in every City Club forum, you can participate with your questions. You can text them to 330-541-5794. That number again is 330-541-5794. And if you're on Twitter, you can also tweet them at the City Club, and we'll work them into the program. As we begin, I want to thank sponsors and members who have stepped up to support our efforts to continue the conversation in the midst of this crisis. City Club virtual forums are sponsored by Key Bank, Nordson Corporation, and PNC, with additional support from Bank of America, the Cleveland Foundation, and St. Luke's Foundation, and many more generous members, sponsors, and donors who are listed on our website at cityclub.org/thank you. Now, to our mayor, Frank G. Jackson. Mayor Jackson is in the third year of his historic fourth term. Earlier today, he held a press conference, which many may have watched online, and we'll get to the news out of that in a moment. And yesterday, the city announced the extension of the civil emergency order to April 30th. There are currently 148 cases of COVID-19 inside the city, and there have been 2 deaths as well of Clevelanders. Mayor Jackson, we want to thank you so much for joining us today. We're glad to have you back at the City Club, even under these difficult circumstances.
Well, thanks for having me.
As we start, Mayor, I'd like to just recognize the frontline workers who work with you and under you at City Hall and across the city, especially in the health department, who have been working so hard to keep us all safe.
Well, we have good employees at the city of Cleveland, and a lot of people look at public employees in a different light until crisis happens, and then they see the value and expertise that they really display. Public service is an honorable profession, but it's not made for everyone. But those who choose to do it, and they do it well, have a great opportunity to impact the lives of individuals, families, and communities. And in this particular case, it is the health department, as you mentioned, but we have our frontline people, whether in public safety, waste collection, utilities. All these people are out there still working every day.
It's really true, Mr. Mayor, about the value that you really recognize the value of government in a time of crisis like this. There's no private sector entity that can step in and do what you and others at City Hall and what the county government and the state government and the federal government are doing.
Well, it takes leadership, and we all have to play our role. And part of leadership is knowing when is your turn and when is not. And there are times when we should follow the lead of others, and then there's other times we have to get out front. And particularly with the public, in regards to this, we have to be that public face in terms of not only letting people know what we're doing, but really taking action and executing and implementing, not just having the idea of policy, but to have the actual performance of that policy executed is very key in the time of crisis.
Mr. Mayor, this morning at your press conference, you stood not alongside. Of course, all of you were very very responsible in keeping your social distance and taking turns on the stage. But there were representatives from university hospitals, I believe, or the Cleveland Clinic, talking about how our regional hospitals and area hospitals are preparing for a surge that many see as inevitable. Can you talk about what's being done there? And now we know a little bit more of what the plan is to increase capacity?
Well, as you mentioned, leading up to what you just asked, as you mentioned, just a few weeks ago, less than a month ago, we announced our first case in Cleveland, and now we're at 148, and with 2 deaths. If you look at the state of Ohio, in roughly the same period of time, a little bit longer, they've gone from their first case to over 2,000 with over 80 deaths. So you can see this is a very infectious virus. And in order to deal with this virus, there is the prevention side, and that is 3 basic rules. And that's stay at home, except for essential and necessary travel, whether it's with looking after someone or having to go to a grocery store or something like that. Wash your hands frequently. And then if you do have to go out, maintain social distance. Now, that's on the prevention side. But even with the level of shutdown that has happened socially and economically in the state of Ohio in general, in the country in general, but the state and the city in particular, we still have this tremendous growth in infections. So the healthcare people and infectious disease people are saying that the figures that we have are what we know, but what we don't know is even larger than that. And so they're expecting what they call a surge to occur within the month of April. And what Cleveland is doing and many other cities are doing in Ohio under the leadership of the governor is to create an infrastructure to handle that surge. And that is, how do we create additional bed capacity to pull out of the main hospitals those people who can be at in beds outside of the hospital, to free up beds in the hospital for intensive care and people who are sick as a result of this virus. And that's what we talked about today, and what the hospital has been working with in great collaboration and partnership with all of the networks, Metro Health, Cleveland Clinic, University Hospitals, Sisters of Charity, all working collaboratively together, them working with the state through the National Guard and with the federal government through the Army Corps of Engineers to help build out their capacity and to be able to handle this surge when it comes forward, as they expected to do this month. Now, a couple other things in regards to that. Right now, according to the medical people, there's enough capacity. The surge hits, it will outstrip that capacity. The demand will outstrip the supply of beds and the ability to meet the demand. This surge in the building out to handle that extra demand is what's occurring now. And they believe that they will be able to handle it based on what they're projecting. Now, their problem is the same problem that's facing the entire nation, and that is, how do they have the testing equipment, material, the protective equipment, and the treatment respirators and equipment. And that is one major issue that they still have, because potentially a surge would outstrip that, the availability of that. And then there's also the staffing level. Right now, the healthcare people say they have enough staff to accommodate today and what they project in terms of additional beds that they'll be creating. But if people are getting sick inside their operation, and if the surge is greater than projected, then that will become a problem also. Now, that goes back to the beginning. The more we are behaving in a way that addresses the basic rules of stay at home, wash your hands frequently, and create social distance, the more we're able to do that, then the more likely it is that we will slow up the infections, which will mean the surge will be not as large and the duration of it will not be as long.
Mm-hmm. If you're just joining us, we're speaking. This is the City Club Forum, our Friday forum, presented at this moment in the stay-at-home moment from the studios of IdeaStream. Cleveland Mayor Frank G. Jackson is our guest today, and if you have a question for him, you can text it to 330-541-5794, or if you're on Twitter, you can tweet it at the City Club, and we'll work it into the program as we move along. Mayor Jackson, there's been a lot of talk about how the hospitals will prepare and where excess capacity might be found in the event of the somewhat inevitable increase in cases. And people had talked about the convention center. They talked about using nearby universities and dorm rooms that are now empty because students are at home. What's the plan?
Well, from what the doctors are saying and the hospitals are saying, they're doing what they call in-place increase in capacity. So each hospital is doing in-place increase in capacity. Example, the Cleveland Clinic and UH are working on 1,000 beds at their new medical hospital, the new medical school on Euclid. And so University Hospital is working, I think, with Case Western Reserve potentially the use of space up there. Metro Health is doing so. They're increasing capacity in place, and I know that the Convention Center and Act Center were mentioned, but there was a decision made by the hospitals that they can more effectively and more efficiently and quickly get up to speed and increase beds by 2.5 to 3 times what they're currently able to do by doing it with this method. And it also helps them to have proximity to their home base, which would mean their hospitals, to have quick interactions with as the need arises. So the capacity can be brought online quicker. The service is more efficient by doing it the way that they plan on doing it.
That sounds like extraordinarily good news, Mr. Mayor. Were they able to provide an update on the number of ventilators available for and ICU beds?
Well, they will increase the number of ICU beds by this because they will move patients out of there, and they will have the ability to increase the number of ICU beds by building out internally within the hospital. They did not say exactly what that would be, simply because they are restricted as to those capacities or that capacity by the availability of the equipment, just like with the testing and just like with protective gear. The ventilators are the same thing. There's a limited supply, and that limited supply is dictating a lot of the level of capacity that the hospitals can go up to. But as of now, they're saying that what they're currently doing in their projected capacity increase, they will have whatever they need in order to accommodate that.
Mr. Mayor, we've seen in the national news and in the statewide news a lot of elected officials trying to leverage their platforms and their own offices to advocate on behalf of public health and healthcare workers. Can you talk a little bit about the conversations you've been having at the state and national levels and with other mayors to make sure that healthcare workers locally and public health workers locally have what they need?
Locally, we're having conversations. There are hotels, as you know, they're empty, and so there is conversation that with hotels about providing rooms at a substantially reduced rate that would allow for frontline people, whether first responders or healthcare workers, to be able to utilize those hotel rooms rather than going home, either because they don't want to take the risk of if they are infected to go home, or if they those kinds of things, or it's more convenient for them based on how they have to work. And as this gets more intense and perhaps the workforce decreases and the need for them to be on duty longer, it would be helpful if they're in proximity to whatever the jobs are. So those things are in discussion. There are, I guess, states that have already instituted that. I believe Governor DeWine has talked about it extensively, and I know that we're in conversation with our hotels on the same subject matter. And if I can switch gear a little bit, not
Please.
just with the healthcare workers and our frontline first responders, but the same conversation is happening with our homeless population, and how do we eliminate the congestion and density at the homeless shelters. And one of the ways that is being addressed is through housing people at hotels where they could have the social distancing. And Metro Health is looking to do mass testing to see about symptoms and whether or not someone in the homeless community has the virus or not. So all this is happening at all multiple different levels.
Mayor Jackson, I'm glad that you brought up our city's most vulnerable populations. The issue of what is being done for the homeless in this time of crisis has come up repeatedly in just about every conversation that we've hosted since this COVID crisis began. I know the city works very closely with the county to ensure that those services are delivered. Do you feel that you're making that the partnership is making progress and sufficient progress?
What I do know is the partnership is sincere in their very focused effort to minimize the impact of this on that population. And I know that there's great collaboration, and the county Office of Homeless Services is taking good leadership in regards to this, and we are following their leadership as we are part of the communication with them on strategies and policy. As you know, the county is the lead entity on the homeless issue, and we provide resources to them, but we're working with them. Example, I know not only is there this housing people in hotels, there's the testing that will be done by Metro Health. There's the hand sanitizers at where we know there are encampments of homeless people, and how do we? So we're locating where they are, working with the county on that, and then getting the hand sanitizer there in the right volume, and I guess dispensary so that it can be used by them, and then the information to them. But as you know, the homeless population is not just this monolithic population people think is homeless, right? Well, there's so many different faces to homelessness.
Indeed.
Going from just somebody falling through the crack because they lost their job and got evicted, to someone bouncing around from house to house, to someone who has a chronic mental health issue or some addiction issue, or dual or quadruple diagnosis. So there's multiple facets of this. And County Office of Homeless Services has done a great job in identifying each of those populations, finding out how can they deal with each one of them, because some of that population is not receptive to information no matter how you deliver it. So you're going to have to take a different approach to them, whereas another portion of the homeless population can absorb it and act on information as you give them.
Mr. Mayor, what are you most worried about right now?
I don't know if it's worried. I tend to worry about stuff after the fact because I'm in the mode of dealing with it.
Right.
And if I worried about it or had some hesitancy in regards to something or some fear, then we'll lose.
Well, it's not so much about that. I'm really asking kind of where it seems as though the city and the county and the state have made a lot of progress in terms of flattening the curve and fighting this back. However, there are places where maybe the message hasn't been received, or areas where now that you've gotten through this part, you really need to get to the next part. So what's on your mind? What are the next biggest priorities?
Well, I will say to you and to whoever's listening that it is about the three basics rules. It is. Stay at home. Stay at home. Don't congregate. Keep social distance.
Are you concerned that enough people aren't hearing that message?
I'm not concerned that they're not hearing it. People after a while get kind of antsy because we're social beings, so they figure out a way to congregate. And so we have to address that. And the governor was very specific in terms of businesses that he is saying you cannot operate. And then there were other businesses he said, well, if you're essential or non-essential, and then there's some gray area. And that's why he's formed this review panel to kind of handle disputes in regards to what's essential or not, or differences from one county to another to get some consistency throughout the state. But we have to, couple of things. There are some businesses or some things where there's social gathering where people just gravitate back to it. And once we find that out, we go to that location, whether it's a health department responsibility or public safety responsibility, and we let them know you can't do this.
I think churches would be probably a pretty good example of that. A
pretty good example. Now, I know that there are some states that have exempted churches. I don't know if that's a good idea, but I don't believe the state of Ohio has. And we are saying to churches, if they ask us, that you should, if you're going to have services, you should create social distance and minimize the number of people who come to the time of worship. There are some churches who have completely gone to online services and things like that. I just got someone gave me an information this morning and sent me something, a text, it's showing a funeral, and the funeral was sparsely attended. They showed me a picture, sparsely attended, and several of the people at the funeral had on masks, and no one was sitting next to each other. So I'm saying that it is getting out. People are listening, but we are social creatures.
I would imagine you're probably also seeing reports and hearing reports of churches and funerals with large gatherings where people aren't keeping their distance. And
yes.
What are you doing in those cases?
Well, usually those things resolve themselves because by the time you get notified of it and you have a chance to respond to it, the gathering is over with. But if in fact it is not, then we do take those measures of letting them know that it should not happen. And I don't believe, no one has said to me that we've had anyone once told that what they're doing is inappropriate, didn't respond in the right way.
Mr. Mayor, as a city where the schools are under mayoral control, you have an extraordinary responsibility for the tens of thousands of students and families who rely on the schools in the Cleveland Metro School District. I wanted to give you a chance to speak directly to them about this crisis, and also to give your assessment of how the schools have responded so far.
Well, I'll know how they responded, whether it's effective or not. We'll figure that out as time goes on, whether it's effective, because we can have all the right policies in place and say the right thing, but are we executing and implementing in a way that we're having the impact or the outcome that we want? We don't know that yet. And when you have 40,000 students, and even if you create a process for learning, and you're requiring certain things, I don't know how many people are complying with whatever it is that the school system is set in place. I know with my grandkids, the younger ones, they are receiving homework from the school, and then it's up to the parent then to make sure that they do that work, hand it in, and all that of that. But that's completely different in a structured environment that has to occur. The other thing that you may have is you may have employees that have children that are, and those employees are essential employees, so they're still at work, or they're working, doing something, but their children are at home. And so how do you ensure that whatever is set in place for them to get their education is actually happening? So we'll measure that in a little bit.
I would imagine that some of your employees in City Hall are in that very situation.
Oh yeah, well, City Hall is closed down. It pretty much is only open on Tuesdays and Wednesdays, and that's just for essential employees. So City Hall, and even on Tuesday and Thursday, is not open to the public. Is open only to essential employees who have to do some things. But it's more of a problem with essential employees that are in the public safety realm, or in the health department, or in public works, waste collection, utilities, people who actually are still going to work every day. They put in their hours. They put in hours. They're not working from home because you can't pick up trash from home. You can't, repair water lines from home. You see, so those are the ones who are the most affected if they have children, in the monitoring of children during that time.
We're talking with Mayor Jackson at the City Club Friday Forum today. If you have a question, you can text it to 330-541-5794. That's 330-541-5794. I'm Dan Moulthrop with the City Club. And as we get into those questions, Mr. Mayor, I just wanted to ask you kind of a long-term question about the future of revenues that support the city's budget.
Right.
This is an extraordinary time. This economic contraction is likely to be felt for years to come. You were just in office when you faced in your first term the economic contraction of 2008, and you managed that very well, as many will recall. What are you doing right now to prepare for something similar?
Well, my belief is that you prepare for hard times and good times, and you prepare for good times and hard times. So during my submittal of the general fund budget to City Council, I made mention to them that we were anticipating a recession, and so that this budget that we presented to them was structurally balanced with some reserves, and that those reserves were put in place so that we could weather the storm during the recession, the downturn of the economy. Now, of course, didn't know this was going to happen, and it was going to happen this way or happen so quickly and at this magnitude. But we were preparing for a recession because we knew one was coming. Now, that being said, the impact of the basic shutdown or the lockdown of the general economy has had significant impact on local government revenue, because Ohio revenues for local government is primarily based on income tax, and whether it's through corporate profit or payroll taxes. And when people are laid off or companies are closed down and profits go down, that has a significant impact. And then that has impact on revenues associated with restaurants or parking or all those other kind of revenue sources that come from into the city of Cleveland. So we're going to feel it. We're going to feel it, and we don't know exactly what that is right now, simply because when we do our look at income tax coming in, is usually a month behind. So we will know sometime in March, probably mid-March, late March, as to the true impact that impacted us for March. And from that, we will make adjustments based on that and project out that impact to see what we will have to do in order to balance our budget and keep it balanced by law. Having the reserve will give us some flexibility to continue some services that we would normally have to eliminate or substantially reduce if we did not have the reserve.
Let's bring in some questions from our audience. Rebecca sent us a tweet earlier. We are seeing strong leadership from Governor DeWine and his team, but I'm wondering what examples the mayor is noticing from other cities. What's something he's seen from another Ohio city, either that they've done or through their council or the mayor's office, that he'd like to emulate here?
Well, what I'm almost daily, I talk to, we're on a call with the governor, not only myself, but other mayors. And so it's a daily conversation. And mayors throughout the state of Ohio, particularly mayors of urban centers, are on top of this. And we share with each other the things that we are doing. And with that, we pick up ideas from other mayors, and they pick up ideas from the city of Cleveland. And then we share our concerns with the governor, and then he incorporates our concerns into his policy making and decision making and his announcements at his press conference. So what you're seeing is not something that is based on politics anymore. It's based on the need to work together, collaborate, and to show leadership and direction during a crisis, which has stripped us all of political politics or geographical areas. We all have the same concerns, and we're all working together and sharing ideas with each other.
Mr. Mayor, another question coming back to the schools here, because education is online during the pandemic. Do you believe the city has a digital divide, and what is the city doing to overcome that during the pandemic?
Well, again, there's always a digital divide, but I believe that access to that can be overcome if we can identify who is in need of something and unable to get it, as opposed to someone that even if they had it, they wouldn't use it. And that is what we're going to be looking at with the school system, to see what are they seeing as a result of their online educational attempts. Are people responding? Are parents helping their kids do what they have to do? Is there a need for certain technology in order for us to be able to help people be able to get the education that they need?
So if there's a family listening right now that isn't able to access the online educational offerings from their child's school, what should they do?
Well, they should let us know. And now they can. Our mayor's action line takes calls all the time, even though they're not here. They work from home some days a week. On Tuesday and Wednesdays they are here, and what they miss during the week they respond to when they get here. I'm pretty sure that the school system has access line that they can call in on also. But the mayor's action line is 664. I think is 2900.
664-2900. That's 216-664-2900 is the mayor's action line.
And what that does is they handle not only complaints, but they also handle the feedback from people. So they keep account of what is on people's minds and where they have concerns or where they have issues. And once we get that and we're able to see that there's a trend going in a certain way or a specific thing that pops up, then we either deal with the entity that's responsible other than the city, or we handle it ourselves.
Mr. Mayor, there's a few questions about the small business, the environment for small businesses, and the challenges that small businesses are facing, both for-profit businesses and not-for-profits. What sort of outreach is the city and the Economic Development Department doing to ensure small businesses are aware of the available $350 billion in stimulus resources through the Small Business Administration, the Economic Injury Disaster Loan Program, and the Paycheck Protection Program?
Well, we're putting a list together to do exactly what you're saying. How do we outreach? But you have organizations, whether it's formerly called WireNet, you have COSI. The county has this, what is it? I forget the name of the entity that they established for small business center, where there is like a clearinghouse for information and direction. And what we've done is that City Council passed a couple of weeks ago at their last council meeting of legislation that allows us to forego loans that we have made to businesses for a 6-month period, meaning that they don't have to, I think they don't have to start repaying interest or principal until January of next year. And that, and we've also set up $1 million account for $10,000 per business that qualifies, where we will help them to reimburse them on expenses that they've incurred during the month of March, to help tide them over into these stimulus dollars come through, and there's an infrastructure where they can access that.
Is that $10,000 a grant or a loan?
Well, that $10,000 is a loan, again, not payable until sometime next year. The first one we did were loans that we've already created, that were, whatever they were, that will allow people 6 months of grace there. This would be a loan not payable till sometime beginning next year, and I think $150 a month until you pay it off.
Continuing with questions about small businesses, this listener asks, what will you do to help tenants at the West Side Market? Rent is due, and many of us don't have the funds to pay it. Lifting the parking gates would help stop discouraging customers. A bottle of hand sanitizer for each stand would be appreciated. I don't feel this is a lot to ask. Help us. This apparently from a listener who is a tenant at the West Side Market.
Well, there's a lot that we're doing for the West Side Market, not only in terms of capital investment, and we have a RFP out, and a consultant will be brought on board to talk about tenant mix and how to market the market better, and how to create a way of communication, not only from the tenants who are the vendors, but also from the public who may have concern about vendors. And so we're doing that. We've created this, and we work with the tenant organization to look at how can their customers call in and have curbside pickup, which has worked pretty well. And in terms of lifting the parking and people not having to pay for parking, if someone is validated that they are a customer of the market, then they have free parking, I think, for 90 minutes. So that is addressed. We are allowing the West Side Market to stay open, and because they've asked for this, we are. Some vendors are showing up, some are not. We are helping them by working with the tenant organization on this pickup, where people can order stuff and pick it up. They don't have to come into the market. And there has been a request come in for a reduction or forgiveness of rent for the month of March or maybe April. That is currently under review as we look at the market going forward as to how it will function, because there's still social distancing issues that we have to address at the market, and if in fact we're just letting people in and you have the kind of congestion that is there, that's not social distancing. So we're reviewing whether or not right now we're allowing it to continue to function as long as it can function with some social distancing and having people order and picking up outside is helping a great degree there.
Mr. Mayor, there's a few questions regarding public employees who work for the fire department or the police department or work at City Hall. One question has to do with how are you handling city employees who want to work from home full time versus only the 2 days, or don't feel comfortable coming into into buildings on those 2 days when the buildings are open?
Well, again, if let's take the safety first. I know that the police department has thermometers, so every day they check officers coming in as to whether or not they have a fever or they're displaying symptoms, and then they act appropriately according to that. EMS, fire, and police are essential employees. They can't operate from home, and so, but they have all of the protective gear in their vehicles that they need in order to do their job and do it safely. The 911 calls that come in are being screened to see if, in fact, someone is likely to be someone with a symptom, and that's a different response than it would be if it were just a straight 911 call. And now, in terms of people coming into City Hall, they have essential employees, and those employees will come to City Hall and work at City Hall or work at their job. If they can work at their job from home, then that will be up to the Human Resources Office and the department and the division that they're working for as to whether or not their essential duty can be done at home or cannot be done at home. That's a determination that will be made there. If they're coming into City Hall, we tell people, if you have symptoms, don't come. Don't come to work. If you do have symptoms, stay at home. Quarantine yourself. Stay at home. So we have created a process that I believe has allowed us to keep our employees safe, as well as deliver essential services, and to keep the city open and running, so that people can at least have the basics of city services, of public safety, waste collection, utilities. All those other things are essential for just people to have a normal daily life. And there are essential employees that have to make that happen.
And the same is true, sir, for those who are in the among the ranks of the first responders. If they are feeling symptomatic, or then they should. There's a policy that in public safety they are essential and critical employees as set by, I think, CDC rules, which means that there has to be some. They just can't say that they're sick, if my understanding of it is correct. That there has to be a verification of that, and then with our hospitals, if there are symptoms, then they go to the front of the line in terms of getting tested to see if they have the virus or not. If they don't have the virus, then the expectation is that they will perform their job. Now, they've created conditions in, like with the police, everybody's in a one-man car now. There's no two people to a car, so there's social distancing. You have EMS; they wear a mask when they're at work and operating, doing what they do on the ambulances, things like that. Fire has protective equipment, and since they have to go out as a crew and they live together, the expectation is that they will practice all of the social distancing they need to practice, as well as
cleaning of equipment and washing hands on a frequent basis.
If you have a question for Mayor Frank Jackson as part of this Friday forum from the City Club of Cleveland, you can text that question to 330-541-5794. That number again to text your question is 330-541-5794. Mr. Mayor, another question from our audience. Is it true that the police are ticketing people for walking downtown even if they are not congregating?
I have not heard that people are being ticketed by the police for walking downtown. I have not heard that. As a matter of fact, that's a policy decision that would be funneled through the executive policy group under the mayor's proclamation of a civil emergency. And what they would do is they would vet that, and then they would either say, no, you can't do that, or if there's a recommendation they believe is valid, then they would bring it to the mayor's office where we can make a decision on it. But we don't have a curfew.
Mm-hmm.
So we're not telling people if you're walking down the street, we're giving you a ticket for curfew. Now, so we don't have that.
Mr. Mayor, some construction sites are still open, and there's a question here about whether the city will open services on a larger scale for some other departments, such as the departments that handle permits for building and construction, which would put people to work or keep people working. And the listeners suggest that this would still be safe, as work would be out of doors for the most part.
Well, we've already anticipated that and believe that we have addressed that. One of the reasons for City Hall to be open on Tuesdays and Wednesday is so that people can come to City Hall, even though they can't access it and come in. If they have a building, a house, and need a permit or file some kind of document, what can happen is they come in at the security. Then the security calls building and housing. Someone comes down, pick up whatever it is that they have, and then process that. If it can be processed and they can wait, then they'll process it and wait and give the person whatever they need to do whatever they have to do. If it's something that would take a while, then they'll let them know how to do that. They also inform people that you can do certain things online, and that is why people are saying, well, why do I have to come to City Hall on Tuesday and Thursday? I can do my work at home. Well, maybe you can't if you have to ensure that business in this regard continues by issuing permits, reviewing documents, and things like that. Those are essential employees. They may not be first responders or frontline people like waste collection and utilities working out in the street or reconnecting water and electricity. But they're essential employees for us to continue the basic work of the city of Cleveland. And one of those things is reviewing permits and documents and things like that. So they can do it on Tuesdays and Wednesdays. They just can't come in, but they can leave their what they need at the desk. Someone to come down and pick it up and process it.
Mr. Mayor, there's a pair of questions here regarding housing issues. Mm-hmm. Will Cleveland go forward with an eviction moratorium? It's been mentioned, but is there a timetable?
It is my understanding. Now, that's something that is handled through the housing court. Mm-hmm. It's my understanding, and talking to the council president, as you know, he was the initiator of this fund that went to United Way to help people in eviction cases. And so we have contacted the housing court, city council has, the council president, to ask them to not have evictions. It's my understanding that the housing court has agreed on that, has really put a moratorium on evictions at this time. Now, at the same time, it does not say to people that they don't have to pay their rent. It just means that if, for whatever reason, because of the virus, you wind up out of work and you can't pay your rent, this is another tool to help you stay in place until you can catch up. But if people are working, they should pay their rent. It's just like when we have put a moratorium on stopping the cutoff of water and electricity for Cleveland Public Power and our water division. Well, our expectation is people will still pay their bills if they're able to pay their bills. But if, in fact, as a result of the virus, they become unemployed and they can't, then we will not be cutting off their water or electricity with Cleveland Public Power. And we will restore cutoffs if requested by the homeowner or the property owner.
If tenants are not able to pay their rent, then there's a ripple effect that landlords then bear the brunt of.
Yes.
What is being done for them?
Well, that becomes the problem of small businesses. And if you're a business and landlord is a business, they own property, their business is renting out apartments to people, that becomes part of accessing small business through the stimulus package and perhaps qualify for the gap money that we could help them with in order to hold them over until this money from the federal government comes through and there's an infrastructure set up for it. Now, what I've been advised as I've talked to people about the stimulus package on the SBA loans at banks is that what businesses should do, small business should do, is to put in their application for the loan, and then banks will front the money, so to speak, or put the money, loan them the money, and if the business keeps a certain percentage of their employees in place, then the guarantee is from the federal government of that loan. And the federal government then, through their stimulus package, if I'm understanding it correctly, will then pay off that loan because they guarantee it.
That's my understanding as well.
Right.
The concern I think many would have, particularly in the real estate industry and the kind of smaller landlords who might only have 1 or 2 or 3 units that they're renting, is that they may not be structured as a corporation with employees and payroll. Mm-hmm. That rather this is something they do on the side perhaps, or they do as their primary mode of income, but it's not structured in that same way that a small business, right, an official small business or corporation in the state of Ohio might be structured. Do you anticipate being able to offer some relief or assistance to them?
That I'd have to check in. I could not give you a definite answer. I would think that if they are doing it properly, they are reporting it as income to the IRS, which would put them in some type of status. The question is whether or not that status qualifies for a small business loan. That I do not know, but my economic development people would be able to determine that. So if there is a landlord that fits that description that you speak of, we would gladly give them some advice or provide them some assistance as to what direction to go in to find the answer that they need.
And they can call your hotline. That's 216-664-2900.
Yes, that's the Mayor's Action Line, right.
Mr. Mayor, this is a question that's come in and one that was on my mind as well, and perhaps the question that we might end on here. But how are you personally doing right now? How's your family?
Well, I keep social distance. I really do. Me and my wife at home, and our grandkids come and go periodically, but they're kind of hunkered down too, not really traveling around, not doing much. So we're doing fine. Thanks for asking, but I will say to you that there's no one immune, and that and I know that out of these cases that will happen in this surge, that most people will probably recover if, in fact, the hospital have the essential equipment that they need to assist them. And I know that people who do not have underlying illnesses that are chronic will have a better chance of surviving than those who do have underlying chronic illness. And I know that that the ones who fit that category of being most at risk are older people. But I don't want young people to believe that for some reason they can just weather this storm, because it's a very contagious virus, and I don't know if they fully recognize that if you in some way recover from it or move through it, that you're still
you can still infect other people.
Yeah.
So it comes back to those three rules.
You do have grandparents, right?
Mm-hmm. That's right. So back to those three rules, right? Stay at home, wash your hands, and keep your distance. Mayor Frank G. Jackson is in his 4th term as mayor of the city of Cleveland. Mayor Jackson, we're just so grateful to you for your leadership and for joining us for our City Club Friday Forum today.
And I thank the public for their cooperation and for their understanding of the need to do whatever it is that we have to do to get past this.
I want to thank you very much, sir, and I want to thank all of you for joining us as well. City Club virtual forums are sponsored by KeyBank, Nordson, and PNC, with additional support from Bank of America, Cleveland Foundation, and the St. Luke's Foundation, along with many more generous members, sponsors, and donors who you can find on our website at cityclub.org/thank you. In addition, the Center for Community Solutions reallocated their annual sponsorship to support our virtual forums. They hope their contributions will inspire others to join them in their commitment to the City Club. We thank them for their generosity. If you would like to join them, you can find out more information at cityclub.org or by calling 216-350-5575. We're going to continue to present forums throughout this time. Just find out more at cityclub.org. You can also reach out to us there. I'm Dan Malthrop. Stay strong, stay healthy, and stay close in your hearts if you can't stay close in person. Our forum is adjourned.
For information on upcoming speakers or for podcasts of the City Club, go to cityclub.org.
Production and distribution of City Club forums on IdeaStream are made possible by the generous support of PNC, the Chautauqua Institution, the Cleveland Clinic, and the United Black Fund of Greater Cleveland, Incorporated.